Jeff?
All right, thank you all for coming. First, commissioners, I'd like to note that you all have 2 books this year for your workshops, a capital project book and an operating budget book. We'll be referring to each of them during our reviews. The capital budget book has a summary listing of all planned projects for the next 6 years, along with a profile sheet for each project with some background information and any recommendations if applicable. Before we get started, I also want to mention we're trying to better streamline this budget review process as well as provide more pertinent information. So if there's any information we're not providing you would like or prefer, please let us know and we can get that info to you at our next meeting. And likewise, if we're providing information that's not helpful in your decision-making process, let us know that as well. So on to the work session book. In the front introduction area, we have the budget schedule, the general fund revenue and expenditure summaries, a list of enhancement requests, the municipal tax set-off rebates and differential rates, and a constant yield certification for this upcoming year. The Board of Education is first on our list this year. We'd like to thank the Board of Ed team for their assistance and the information they provided to help us over the past several months, especially with getting an updated and current capital project plan. So if we turn to the Board of Ed tab in your work session book, which is page 12, hopefully everyone has a copy. Basically, this is just 3 line items in our budget that the Board of Education are funded out of. The first line is the main allocation. It shows the $7 million increase we've recommended over last year. The second line is the teacher's retirement, which still shows the $1.288 million. We've recently heard that may be cut in half, so we'll make that update.
It is out of the budget right now.
Okay, we'll make that update. The third line is the funding. It goes to the Parks Department on behalf of the Board of Education for
Field maintenance?
Field maintenance,
Field maintenance.
all the grounds
Yes.
maintenance, that's correct. Yep.
and that stays the same. Next page is the Board of Education's draft budget, and I believe the Board of Education team wanted to touch upon this budget themselves. So I'll hand it over.
Okay,
Thank you.
absolutely. Thank you so much. And I just wanted to say thank you to the commissioners for the opportunity to come and talk through our budget. I did want to recognize that for the first time, we have 2 board members here, Kendra Eichler and Carrie Sutherland. I thank you both for being here and being involved and engaged. It's very refreshing to have board members here and really looking to see what our budget is and helping us along the way. So we appreciate that. I also want to say a huge shout out to Rob Watkins, who has taken on the challenge and has really dug in deep to be able to present to you this evening, to be able to work with our board members and create a budget for this upcoming year. We all know that the environment of budget has been tough. It's getting tougher all the time with all the blueprint requirements, and so not an easy job, but thank you for your leadership with it, because it's been amazing the last 3 weeks and what has been able to be accomplished. So I'm actually going to turn it over to Rob, but just before I do, I want to talk about what you just shared with the $644,000 pension payment on behalf of our employees this year, which leaves $656,000 that was obviously put towards for our use. And so I'm requesting, because we are slated to get cut $433,000 to our foundation money, which once we take out the community schools money, leaves us with $599,000 worth of revenue from the state level, which I know we all can agree is woefully underfunded by the state level. So I just wanted to put that out there. I know that you had committed to the $1.3 million in retirement pension for our employees, and I'd like to see that $556,000 that now is there, committed to the school district to come to us to make up that difference from the 433 we're losing in foundation. So
So the state giveth, and you guys want to taketh away.
that's exactly right. All right, Rob, you're on. Thank you.
Awesome. So,
And we have your presentation, I think, loaded up as well, if you want to go through that versus this is your draft budget, the full package.
Absolutely.
So I believe we did load up the presentation. There's paper copies on the desk as well. So I think so your choice.
and so I would say let's talk off of the slides, and then we can dig into the budget book as needed.
All right, very good.
Does anybody need a copy? We do have additional copies.
Is this what you're going off?
That is what I'm going off of. That is correct. And this was the presentation that we presented to our Board of Education on last Wednesday night.
Oh, one more.
Oh, no.
So you can jump through the first couple of slides. I'm Rob Watkins. I'm the interim supervisor of finance. We have slide 3, please. One more. Perfect. So in our budget book, this is our projected revenue increases. We are projecting 1.426 million as of last Wednesday. As Dr. Salen shared with you, there seems to be some cuts coming down to affect that number. We thank you guys very much for earmarking $7 million to support the Board of Education. So our projected total revenue increase as of last Wednesday was just a little over $8.4 million. And we also noted to the public and to our board that you guys were at the time contributing $1.3 million towards employee pensions, which we just shared. So next up, the full current year operating budget is $118,436,000 and change. We're projecting this year's budget to be almost $476,379. It's a projected increase of $11,039,818. So unfortunately, that puts us in a deficit when we compare the projected increase to the total revenue increase. So this budget book reflects a $2.6+ million deficit. That budget deficit is only reflected in the front 9 pages of the book. The remainder of the book still stays intact with the full operating budget of $11.039 million. So this next page is our proposed increases for our fiscal year 26. So it's broken down by each of the required categories. So we're expecting to see $5.8 million in increases in salaries and wages. We're expecting to see just a little under $650,000 in increased contracted services, supplies and materials at $222,000 plus. Our other charges are $220,000, and our increased in fixed charges is $4.021 million, and equipment is $55,500. That gives us a total increase of the $11.039 million that I shared, and then that little table at the bottom shows the deficit at $2.613 million. It's a little pie chart to show you how the increase is spread out over our budget. As you can see, the vast majority of the increases are attending to salary or related charges. And just so for the public, this is what the fixed charges are comprised of. It's comprised of the retirement costs that the board is required to pay, FICA taxes, tuition reimbursement, health insurance, including our marathon health charges, retiree health care, various insurances, background checks, and our legal trust.
And with that being said, I'd like to call Stuart up. Stuart has prepared some data for us. I know that my board specifically had some questions about Marathon Health, and being in the budget environment that we're in right now, this is certainly an added benefit to our staff. And you don't see those results right away. We knew that this was a 5 to 10 year plan, and that so we're not quite even in year 2 yet. That we're not going to necessarily see some huge changes, but Stuart does have some data that I think is worthwhile to express, because I do think we're already making a difference and creating some savings. And so if you don't mind just sharing some of the data points.
Sure, absolutely. Thank you, everybody, for having me here. I've got some data for both the county and the school. Should I just keep it to the school?
No, I mean, I mean,
share?
that's up to the,
No, it's both together, so I think it's important to share the whole.
Okay. Well, to start off, I want to kind of explain the background. I'm Stuart Sutley with Bolton Health, so we help manage the benefits, the health benefits for the county and the school, and the ESMEC trust in general. And we really see these health centers as a way to not only bring great benefits, help with recruiting and retention, but also as a way to stabilize health spend in the future. These health centers are a fixed cost, and that's very important because if you think about being self-insured, everything is kind of a variable expense. You don't know what you're going to pay until procedures have happened, the bill comes in and you pay it. So the more that we can drive people to use the health center into this fixed cost environment, whether somebody uses it once a month or 30 times a month, the cost stays the same. Then we're starting to stabilize cost. I have personally put in over 50 of these health centers in my career, and the vast majority of them are still open and operating very well. And so we really see this as a unique opportunity. The county and the school were the first two to kind of jump into this in Maryland, although this strategy has been deployed in all other parts of the country. And since then, just for reference, St. Mary's County, St. Mary's Schools, Washington County Schools, Wycomico County, Wycomico Schools, Frederick County, and Talbot County Schools have all moved forward with the same strategy. And there are 3 counties and 2 schools that are in final contracting right now. So we really, a lot of that is based on the outcomes. As Dr. Salen said, it's important to know that this is a strategy that takes a little while to see the benefit. Overall, the goal by the end of 2 years was to have 35% utilization of the health center, because at that point you get to kind of a break even to where now the health center is really starting to accrue savings to the bottom line. Bolton, we have actuaries that look at these numbers all the time, and we're monitoring this very closely. So some important stats. The county, this is through end of January, and so again, it's probably a little better, but the county is at 34.7% total utilization, so they're almost right there before the 2-year mark. And the school is a little over 29%. So we got a little more catch up to do with the school, but getting there. I think the important part to know for the county is that of the employees and dependents, 45% of the employees are using the health center, and for the school, 33%. And again, that's not only going to help with your healthcare costs, it's going to help with absenteeism, it's going to help with keeping people at work, things like that. So there are some other, again, benefits that accrue to that.
Stuart, can I ask a question?
Yes, sir.
To kind of qualify the numbers that we're putting out there. So the county employees, obviously, they work in and around where they can utilize the health center. I understand, I watched the 3-hour meeting, and I appreciate, by the way, the job you did was phenomenal in that meeting, and the board, great questions. I just want to give credit where credit is due. Best I've seen in 10 years, quite frankly. But to that point, when it was raised at the board meeting, it was about the 27%, was the number they used at the board meeting. My question is, and I know teachers live out of the county, so, and the conversation was they're less likely to be able to get to the health center because of the hours they work, where they may be in the county. But I talked to Jim about this. When we're looking at it, if we take the teachers that don't live in the county, take them out of the equation, is that 27% on all the teachers, or is that just on the teachers that live in the county? And the reason I want to frame that way is because as health centers open up across the state, those teachers will now have the availability of those health centers, which will then, you're going to have a rise in the usage, a natural rise. So I think it's unfair to look at if we have 600 teachers in the county, just say, to use a number. I think we have to look at the percentage of those 600 that are utilizing this health center to get a true indication of what our county teachers are using for the health center at this time. I think it's unfair to use the other half of the teachers that don't live in the county because there's not other opportunities.
So this is everybody. So to your point, well taken. And yes, there is a reciprocity agreement in place. So for example, when the Talbot Schools Health Center opens, there will be access. So that will be certainly an advantage. The other thing is we have moved the pricing to a fixed cost arrangement. It used to be kind of on number of eligible lives. So we were able to go back to the vendor and put in a fixed cost moving forward so that it doesn't affect as much with people who live out of it. So what we came We just reduced the annual cost for the county by $150,000 for next year, and for the school by $175,000 by coming in with a fixed cost, because we realize that some of the folks don't live close enough. So that some of that calculation took place. And a lot of that feedback came from the county and the school, like, how can we tighten this up some? So
Based on
great
your number,
progress.
that's over 10% reduction then, right? Because you were at 1.6, right?
Yeah,
Yes.
1.5
Yes.
something, so
Yes.
1.6, yeah.
So basically 10%
Yes.
reduction there.
Yes.
So that's fair.
Yep.
That's fair.
Yep. So a couple more quick stats. I think this is great. Over the last 12 months, the county has had 1,861 appointments. For the school, 2,245 appointments over the last 12 months. Really great numbers. When they go into the health center, they get screened, they get their biometric data, a lot of data points. For those who have been using the health center, 71% of the county patients are making health improvement. 68% of the school patients are making health improvement. So we're seeing better results, better numbers. That is part of the goal of this, is to manage people in good primary care. From a savings standpoint, understand that a lot of this is redirection of care. So again, we're trying to get people into the health center. Some of it is cost avoidance. But based on the length of the appointments, the average appointment for each individual is 36 minutes. If you go out to a community doctor who is fee-for-service, the average length is 12. And the physicians bill on that. If you were a chronic patient, they would bill more for you to stay for more time. So a 36-minute appointment in the local market equates to $508. So if you take all those numbers, based on the number of appointments we've had, we have moved $670,000 of appointment time that would have been in the market into the health center for the county, and $875,000 for the school. So again, we're already starting to see the beneficial impact to the cost of the health plan by putting people in here. We've had 107 county members and 93 school district patients who have seen reductions in A1C or diabetes, BMI reductions, and blood pressure, and that savings has equated to over $500 according to our actuaries. Three more quick stats. Part of this is how do we keep people from using unnecessary care like emergency room visits, urgent care visits, or referrals to health systems that are unnecessary. So again, we have seen from the county and the school combined, we have seen about 325 people that did not have to go to a specialist because it was able to be solved there. Remember, in these 12-minute appointments, it's not the doctor's fault, it's the model, but they usually have to refer you because they don't have time. They got 6 patients waiting. When you have time, you can really dig into things and help people with their challenges. So that's been really significant. And the combined savings in an estimate of not having to go to ER visits, avoiding visits because of the same day, next day access, between both groups equated to another $125,000 in savings. And lastly, and I think this is important, because there are no copays, when a member comes to the health center, I think this is great. The Queen Anne's County employees have saved an estimated $58,000 in out-of-pocket savings, and the school has saved over $76,000 in, the faculty and staff in out-of-pocket savings. So there's also been a really nice benefit to the faculty, staff, and the workers in the county as well. Thank you very much.
Very
Appreciate it.
helpful.
Thank you, Scott.
Nice numbers. I guess to add on to Stuart's, and then I think and then I was involved at the beginning of this with Beverly and all, so I got a really good bird's eye view of how this worked and the fact that it's an investment over time to reduce costs. It's not, we're gonna see it immediate. The trend is 3 to 5 years, I think, 5 to 7 on the outside, but once you reverse that trend, and the one thing we forget is this is about healthcare, just like schools are about kids. If we're doing maintenance healthcare, our acute care costs over time are going to go down. And that's where we're going to save the big money in our health plans. So I think that's what we got to keep in a focus, is this is more about the return on investment later on the investment that we make now.
Yeah, and same thing as it works for us contractually, knowing that we had our independent folks getting 100% reimbursement. Now we've got a percentage in there for any new people who come on board. So over the next really 5 to 10 years, you're going to see a significant reduction in what we have to pay as it relates to premiums for our employees. So I think the two things combined together will be a good recipe to help to flatten out that insurance rise every year.
You go back one more slide for me. It's all right. So in your slideshows, you have the entire budget laid out, but this is a good representation of how the entire budget lays out as far as funds go. So again, almost 84% of the total dollars that go to the Board of Education go to support salaries, wages, and the fixed charges. The contracted services there make up about 9% of the budget. A good chunk of that goes to transportation. Supplies and materials are the things, just 2%, but it goes, that's what goes to support the instructional programs and the materials on instruction in our buildings. And then the other charges, in some places contribute to that, and in some places contribute to the operation of plant. The largest other charge goes to our operation of plant. Equipment and transfers make up a very small percentage of our total budget. And then so at this point, I present really that we're in a deficit, and we are actively working to present our board at next week's meeting some adjustments that we have found as we have done some budget analysis. All right. So that is the end of the formal presentation. I'm happy to answer any questions or go through more of the budget book if you would like.
We're in the second year of a 3-year contract, correct?
Correct.
So of the 53% of the salary increase wages, we pretty much know what it's going to be next year in the third. What is that?
6 million, 6 to 7 million. I'm thinking it's going to be closer to 7.
Increase in salaries.
Correct.
Well, salaries and overall plan, because that would also include like a 3% inflation rate on everything from, mostly in our operations, from electric to energy
And this was part of that mandate to make sure that we got to the minimum $60,000 salary.
Blueprint.
Yep.
So 6 to 7 million.
It's I would say 7 is a good
Yeah,
estimate.
I think that we, again, will be challenged with the state.
And that's because of the contract, though.
Well, so remember the state has mandated us to hit these targets, and we have. And so you guys have funded us at a much higher percentage than the new state funding has coming in. So you guys are much closer, a little over 9%.
Thank you for that acknowledgement.
But you know, the state came in a little over 3%. So we appreciate your support. As we continue to grow our program and create the opportunity for teachers to come to Queen Anne's County and stay in Queen Anne's County, that minimum salary is an important part of it. But it is a mandate from the blueprint, for
Yeah,
sure.
and there's several other mandates that are increasing. Your national board certification is a pretty big price tag. Your dual enrollment is a pretty big price tag. AP has even increased as a result of the blueprint. And you couple that with, as we said, the inflationary part of things. If we estimate that the state gives us the same as they gave us next year that they're giving this year, it's probably going to be at that $7 million mark. And that's assuming about a $600,000 give on the states, because they're not estimating giving us additional foundation money until the following year. And then it's supposed to start coming, but right now, next year is not, they're not providing us with any information that we would see an increase in our revenue over and above what we would see this year.
I got questions, I just got away from my chart.
Oh, okay.
I had it here, I don't know what happened to it.
Well, I can ask, I mean, you have a deficit for FY '26, obviously, and likely you'll be in a deficit mode in FY '27. What steps are you going to take between now and your work session next Tuesday or next Wednesday to
So-
bridge that gap?
Yeah, so Rob did allude to it, that the team has spent a significant amount of time literally going line item by line item in the budget. Rob's been able to take a different level of look, I guess that's the way you could say it, right? Robin's been good enough to come in, and they've literally been going down and looking to see, where is there an opportunity for us to either freeze funds or fold funds. And so we will be presenting that to our board, all of that hard work we did, which does take a nice chunk of money out of that deficit. I think basically we have to remember too that those furlough days are what we're kind of making up. So nearly 2 million of that really is from the furlough days. So we won't be in that same position next year is what I'm trying to suggest. So once we fix that furlough deficit, then we really won't be in that position next year. So we should not see a deficit. Once we've cleaned up, as I said, the part that the board's asked us to go into and take a hard line, and things like, recruitment line item. Obviously, we're not going out and recruiting teachers right now. So we're, taking that line item and putting it in a better use. So things like that, and we'll be sharing all those things with the board next Wednesday. But we should not, I disagree. I don't think we'll be in that deficit mode. I think we will be as it relates maybe to the increase in the salary enhancement package if we don't get, what we just talked about. But as it relates to that, I don't believe that to be true. And the team can certainly jump in if they feel differently.
So if I could, can you verify that the numbers we have for 26 from the state are right? 43,557, 955. Make sure.
What are you asking?
What the state is actual for 26 coming that they're projecting is 43,557, 955.
43,557,955.
Okay.
Yep.
As long as the bill that's out there right now doesn't pass.
I
Yeah,
know, but I want to bring to, I got to bring to the attention of everybody again, because I've done it for many years going into this. Our projected from the state into FY26 from the original Kerwin plan was 45,800,000. That is a deficit from the state of 2.242045.
Which is pretty much our deficit.
I know, and it was last year too, by the way.
Yes, it
Crazy how
was.
that works, right?
Yeah.
But again, I want to make this
Oh, it's
point
so true.
because
It's-
what I've said at the budget hearings for the last 2 years at least, to the teachers when they come and ask about this is, I didn't see them in Annapolis. And as Mako president, I was in Annapolis a lot this year. They can't come in when we do our budget hearings in May and ask these commissioners to go over and above. We're at 30% over 3 years right now. We're probably third or fourth in the state for percentage increase right now. They've got to do their due diligence. They're the largest lobbying group in the state of Maryland, and I did not see them in Annapolis this year. And I have to listen to the state legislators stand up there and say they're fully funding education, and that's a lie. To everybody in this state, every child in this state, every parent in this state, that is a lie. Because if they were fully funding it, we'd be getting $45,800,000 this year. And I just want that to be out there on the record.
And I completely agree with you, and I thank you for bringing that, to the surface. I will say that our team meets with the joint labor. We have a joint labor meeting, so we meet with the union once a month, and we have said exactly that to them every single month. We've even allowed their MSE rep to go school by school, which we typically would never do, to be able to sit and educate teachers and staff members on how they can support in Annapolis. So we have put it out there, we promoted it, we've encouraged it, but I haven't seen it either, unfortunately.
And I do that for our board members, the newer board members that don't realize that this has been an ongoing thing since 2018 when the blueprint was first put on down and numbers were put down. And keep in mind too, we're still operating up to this year on figures from 2018, and this is 2025, and we've been through that thing called COVID, which really shocked the world, right?
Yeah.
And yet we're still working on numbers from 2018. Show me another area we budget that we're working on numbers from 2018. And that's where the deficits are falling, like I said. And next year, and I'm sure you guys have this number, Todd shared it with you. So you look at it with very minimal conservative forecasts by 2030, the state will have shorted us that year, just that year, $6,809,139. It can't go on. It can't. I mean, I don't know what else to say as a commissioner. Look, we're doing all we can do, but there's just a point where, we've got all the DES folks, everybody else sitting out there that's going to come in here and ask for, the same kind of increases. And I feel for you guys. Look, I know. I've seen it. I've been there. I've watched it and been a part of it. And I don't know what the answer is. I
Well,
really don't.
we just appreciate that you do understand it, to be very honest with you, because there's a lot of commissioners throughout the state that do not. And, I mean, you know, I know it's tight on us, and I know that we're doing the best we can, and we're gonna be okay, but there's some districts this year that are cutting hundreds and hundreds of positions.
Yeah, no,
And we would be cutting 100 positions if you weren't doing what you were doing. People need to understand that. That $7 million translates into some serious staff members.
Yeah.
And we have to recognize, we would not be able to function if we had to cut another 100 teachers. We just couldn't.
And not to cut you off, but that's taking into account that we trust the state to give us the big bump in 28.
Right, it is, absolutely.
That is a huge bump that we were supposed to get. If they nix that 2.3 or $2.4 million jump, that number's going to be closer to $9 million
Yes.
that will be short. And right now, we're 9 million, I believe, underfunded over the last 5 years, right? Isn't that what we came up with the other night? So we're 9 million. Imagine if you had 9 million.
I
you were
know,
in a
I mean, the
fund right now.
coaches that we would have in the schools, I mean, you know, smaller class sizes, increased programming, like, we haven't had a textbook line item, we've been cutting that. Some of our textbooks are, gosh, I don't even know, 15,
yeah, decades
15 or more years old. I mean, I could, it would be amazing that amount of money would be a game changer in the district. And it's really sad.
And, you know, coming from sitting as a commissioner, it's not fair for me as a county commissioner, or any of us as county commissioners, to vote to raise the taxes on the Queen Anne's County citizens because the state's not giving us the money
They're
we're already
doing their
sending them.
share.
I mean, we're sending them money over there expecting it to come back in good faith based on the numbers they gave us. And again, we're just asking, give us what you said 7 years ago.
Exactly.
We're not even asking
Just
for anything above that.
outdated, yes,
Just give
exactly.
us the 7-year-ago money and we'll be whole. You know, we can fix $200,000-$300,000. We can fix that, but when it starts getting to $3, $4, $5, $6 million year over year, it's just not sustainable, and I think we all know that.
We do know that,
So
yeah.
that's all I had.
Thank you.
I know you said something, Patrick asked the question about 27, it's the third year of your contract. So what do you see for 28, 29, and those out years? I mean, you know, when we had this discussion 2 years ago, we were talking somewhere in the neighborhood 7 million, 7 million, and 7 million. And then we thought we'd be fine, but I guess my concern is if you go back to negotiate your contract,
We will.
and there's, I don't want to say massive bumps, but, you know, the salaries keep going in the direction they're going now, will we ever be able to catch up?
Well, I mean, that's a total negotiation. Like, it's hard to actually predict that. And I mean, and Michael can jump in, and he's our chief negotiator, Michael Knoll, Dr. Knoll. But I have a hard time understanding that after an 18% increase over 3 years, that we would see anything that would be similar to that.
That was in due to Kerwin and the salary starts in the realignment of salaries?
Yes, so
Good,
it was
okay.
18% over 3 years, and then we go back to the table.
Never before has
A
a end
law.
result come out before negotiations.
Right.
Where you have to get your buy, and you've got 3 years to get it. So we have had to fast track the salary increments to get to that 60. Once we hit that 60, those 6% over each year for 18%, those days are going to have to be gone, and we're going to have to go back to where past negotiations have been, which are much more realistic.
So, but how much is salary compression going to affect that, though? I mean, as you keep bringing these teachers in, you've got tenured teachers that are there 15 years that have been under the old STEP program and they've gotten their steps. Now you're bringing teachers in at 60,000. That delta between them and them 15-year teachers is going to be really close. And we all know what salary compression is and what happens. So when they come back in that new contract, to Jim's point, are they coming back and going, wait a minute, those teachers just caught up to us within 3% over 3-year period, just say, because all new teachers are going to be at 60,000 guaranteed, right? Where we're starting teachers at what, 51? What were we starting 3 years ago? 52, 53?
We were low 50s.
Yeah, 52.
Okay, so what's that, almost that's a 20% raise.
Well, that was the question I've asked. The compression was taken care of in this contract. So coming out of this contract, the compression portion of it should be where it needs to be.
It should be, because
Only for
the
new
whole-
teachers, it doesn't
No,
help
no,
you at all.
no. The whole, well, for one thing, the whole point of the blueprint is to get teachers to their highest salary in a more reasonable amount of time, instead of waiting until you get to, in our case, 20 years.
Right.
Or really 30 years, right, to get to that. They're trying to compress that so they get to their highest salary, because once you're like a 5-year teacher, pretty much should be a master teacher. Is that master teacher doing anything different in year 5 or expected to do something different in year 5 than a 10-year teacher or a 20-year teacher? No, we're asking them to do the same thing. So that's kind of the concept. But the contract in and of itself, that percentage didn't just hit the first few steps. That percentage really did hit across the board. So a 5th-year teacher this year, even with the furloughs, got like a 4.5% raise. A 10-year teacher still got like a 4.1% raise, where a 20-year teacher still got a 1% raise. So, I mean, did you want to add?
It was proportional.
Right.
Up the scale.
Yes.
Yes,
Scale.
yes.
Okay.
Yeah.
But a higher percent went to that low end, it hit
I
the
got you.
60. The higher end got a raise, just did not get as much of a raise as the low end because we only had to get the low end there, but they still
Right.
got some.
And what is it after that, once it's all phased in? I know you're saying now a 20-year gets 1%, but is that, as that phases in, does it stay at that 4% level when you get to 12, 14, or does it still remain a sliding scale downward? In other words, right now you're catching up, you're at 4.5, and a 20 years at 1%, just say 4.5%
Yeah.
plus 1%.
So that's because of the furloughs. So they would have been at, oh gosh, I don't have it in front of me, but 7% or something on that earlier one, and then 4%, I guess.
It
on the
depends on
last- Right.
what step you're on as to what the percentage was. It was a rolling percent. Again, higher percent at the low end and a much lesser percent as you went up the scale because
Well, can I add too?
Yeah.
We also tried to mitigate that, rather than just giving a flat percentage to everyone, we split what that increase was, and it was like a 1.75% plus a flat adjustment of $1,800, rather than just giving like 5 or 6% across the whole scale, because of what that 5 or 6% would have done to the high end. So it kind of tried to meet them in the middle to kind of get at the point you're making there. So the increases weren't as high as they could have been at the top end. We also got them to bring the first 3 steps up and collapsed all at the same amount to mitigate how much of a percentage increase that we would have had to give. So we had 2 strategies to help us out a little bit.
So where do you think, or do you think, I doubt it anymore, is the career ladder going to become the new, is that going to be what we're going to bargain on, or, for certifications and stuff, or are steps going to stay with us till the end of time, which, I mean, it's an honest
No.
question, right? Because I keep
No.
hearing steps, and they were supposed to go away after Thornton left, and here we are still talking about steps.
steps are, our scale is in the career ladder. So we did not create 2 very separate scales. Our current scale is now in the career ladder, but a teacher basically is maxed out at a step 2 unless they become
certified.
national board certified.
Gotcha, okay.
And then they have the opportunity to hit 3 and 4.
And then they get, is it a one-time bonus, or do they,
No, they get.
they get it year over year, right?
It's not really, it goes into their salary, so it has a compounding factor, but then when they renew, they get additional monies. So what is it, 10?
Pretty, 10 grand, that's what I thought it was,
10,
10,000.
6,
And then it's 6, 5, 4.
6, 5.
So that's 10,000 per year, and then 16,000 per year.
21 and then 25. Right, okay.
And when Kerwin first was out of the gate, way back then, National Board Certification was a 10-year renewal. And then as soon as they made everything official, it became a 5-year renewal. So now those compounding costs are really going to catch up to us significantly. And we have not the most on the shore, but only probably second to Cecil County, I believe, as it relates to board certification. And we have close to 40 in the pipeline right now that are in the process. And we just had another 36.
Yeah, in the next 3 years, we have, those that are in the pipeline plus who we have, we're going to have over 70 national board certified teachers.
So it's a $700,000 bump right there.
Yeah, we're dual enrollment, we feel like we're kind of getting that cost more flatlined, but National Board is just going to continue to rise over the next several years. And why would they not? Of course, it makes a huge difference on their salary and the impact, the compounding factor of that towards their pension and retirement.
What's the savings you think on the healthcare side with going to 90-10 for new teachers? Because obviously any of these teachers that are going to qualify under this coming in.
Unfortunately, I think we hired 7.
We haven't, the last 2 years, we haven't hired that many teachers. That's going to take some time as our experienced teachers retire, and hopefully, starting next year, if we do start hiring again, it'll be for those new folks coming in. But that trend is going to take some time for that pendulum to swing the other way, where we do start to reap those benefits, similar to what Stuart was saying earlier about the health center. It's just going to take some time, but over time, you compound the health center with the new language within our contract for the reduced rates on the employer side. I think there will be a cost savings down the road. We're just not going to taste that yet. It's going to be a while.
And I really believe that we'll get back to our regular hiring, not next year, but I believe in maybe 3 years. You know, we typically hire 60-ish, sometimes a little more. I think we'll get back to those numbers. And so I do believe over that period of time, we will see it to where, you know, 60 people are retiring and you have 60 people coming in that now have this percentage on their,
So
you know.
part of the shortfall last year was the attrition wasn't
Exactly.
anywhere near
No.
what you forecasted.
Yeah.
So where are we with that this
So-
year and projected next year?
Yeah, so
If I'm not
currently-
mistaken, it was 2 last year, and you were anticipating a couple of dozen?
Yeah, well, I think we hired 7 altogether last year, and we typically, as I said, hire like 60, but we had thought probably it was gonna be more like 40.
But my point,
Oh.
my point is retirements.
Mm-hmm.
Projections were a couple of dozen, maybe 3 dozen, and there were only 2 or 3 that
Yeah,
actually.
exactly.
So what are those
Yeah.
numbers this year, and what do you project next year? Because that's part of the,
It is.
this is
Yeah.
part of the shortfall, the
It
$2
is,
million
yeah.
we're talking about.
Hard to project what next year is. This year,
Well-
we have, I believe we have 11 teachers on the books that are retiring this year.
And 6 administrators.
Yes.
And then we have, how many resignations?
We have another probably 6 resignations and a couple that are tentative still.
And probably a half dozen support.
Yes.
So 15 to 20.
15 to 20.
And what do you expect to backfill of that 15 to 20?
Well, certainly the 6 administrators, because we can't run a building without a principal. Right?
And we did those with internal-only postings.
We did them internally only.
Well, you
yeah.
took the support staff and filled in
We-
for the full-time, right?
Well, we had, some of our current APs have applied for principalship positions, so we'll obviously have to backfill them, but we would backfill them with internal candidates. So, I mean, I guess since I've been here, we've hired 27 administrators, and only 8 of them have been from out of the district. So we do typically try our very best to pull from within, and I do anticipate 95% probably. Sometimes we have a challenge at the high school level, especially for administration there. Sometimes it's harder to fill those positions. So, but do you want to add anything to that? Okay, yeah.
But based on that, the 18 to 20 that would move, just say they all stay internal and move up to take those other positions, then we would suspect that we're going to have 18 new hires. Would that be safe?
No.
So you're not going to backfill all those positions?
We won't backfill all.
Which will help with the
That's exactly
loss.
right.
That'll be part of the discussion with our board next week.
Yep, we're prepared for that.
And as of right now, my understanding is, based on that meeting, that the board has not approved this budget that you brought to us tonight, correct?
Correct. We were tasked with going back into the budget and analyze it a little bit deeper and see if we could find some other places that we could pull out. Because
Yeah.
obviously,
We've done-
the folks on the ground, the teachers, the assistants working in the classrooms are super important, so we want to just make sure we're doing our best to keep our workforce as high as it can.
I got an ask.
Please do.
Okay,
Julie Keeley,
yes.
you gotta find her an office.
We will. We just spoke about it today. I said I was going to reach out to Todd, because we've cut several positions, obviously, from the central office in the 4 years I've been here, and so we will have space because of
Great,
that.
it's great. She's doing really good work with
Yeah.
Life Skills and Drug Free Coalition and
And she also has another person on her grant now. Both of them will have a space in the building. It's going to be hard to find a space for all her stuff.
Yeah.
But we will do that. we will do that, yeah.
So I didn't,
We could always pull one of those temporaries around back of the.
No, no.
I didn't get a chance to watch the budget from last Wednesday. What was the angst that your board had as far as the budget? I mean, did they say, these are the areas where we need you to, are they giving you any kind of direction, or?
I don't think I would say that it was an angst. I think they just wanted more time with it, and they wanted to give Rob more time with it. He had only been there for 2 weeks and working with Robin, and so I think it was kind of a decision we made together, like, we can take a couple more weeks, 2 more weeks, and really try to dive deeper into this and see how many more savings we can do without having to go into staffing cuts. So no, I don't think it was necessarily angst. I think they just wanted more information. They asked some really good questions, and I felt like we were able to provide them with some really good information so that they can make some good decisions. But I don't anticipate them saying we're not going to approve this budget.
And you needed a commitment from us, some number to
We
work
did.
with to get
We did,
started.
and we
So
were
in all
thankful.
fairness, we probably only gave it to you a week before that board meeting anyway,
Yeah,
so.
yeah.
Okay.
But he's only been there 2 weeks, so I just
I just want to make sure, I just want to make sure
Rock
Sutherland,
star.
Being on the
Kara
job 2
Sutherland
weeks
is
doing
playing
what you
nice.
did, I would have thought you'd been there for the last 10 years. I mean, literally, there was not a question that came up that you couldn't flip 18 pages over and be like, nope, it's right here, and nope, it's right over here. And again, to the board, you guys asked some
Great
some
questions.
questions I've never heard
Yeah.
asked at a Board of Ed budget meeting. I mean, just some phenomenal
And
questions.
I've been doing this for 9 years, and it was the best budget meeting I've seen too.
And honestly, it wasn't angst, it was legit questions.
Legit
I was sitting
questions.
there
As I
going,
said,
"That's a
yeah,
good
I don't
question."
think, yeah, there was
But
nothing.
to your credit, like I said, you were like, wait a minute, it's,
And you shared that last night at the commissioners meeting.
yeah, no.
I mean, there was no like accusatory, like, you're not doing this right, or they just asked good questions. And we had met with our administrative staff that same day and had gone through an exercise of looking, put them in groups, and they were to look at the budget and come up with, you could cut something, what would it be, type of concept. And several of the board members had picked up several things that the administrators picked up, and we were kind of giggling to ourselves. We were like, we saw that today too. So they did take time. They took time with the budget, and that's just greatly appreciated.
So I must steal Commissioner McLaughlin's thunder that he's been bringing up lately, and I appreciate that he does, is the fact that we get a lot of heat for the fact that we're like the lowest per pupil funding in the state. But
Yeah.
Just
the
the
fact of
other
the
day, I
matter
was
is
supposed to.
that, if you look at the numbers, right, for county funding, we're in the top 5.
Top 5.
For coming from the state, we're in the bottom 3.
The bottom.
So it's not hard to figure out that that's what your numbers are going to look like.
Yeah.
Overall, when you look at the state where next door neighbors get 65% of their budget from the state, we're
12,005.
Right.
so, I mean, and again,
Per student.
these are things the public doesn't
Taxpayers make up.
understand,
Yeah.
and the dynamic of how your budget is crafted and how the money comes to you, right? Everybody thinks, oh, the county gives 50 million and the state gives 50 million. That's
Yeah,
not even
that's-
close to true
yeah,
in
that's
Queen Anne's
exactly
County.
right, yeah.
So, it's that whole,
The formula.
the formula
formula.
itself, the way it works is, and whether it's on operating or in Sid's case, on the capital side, there's always that, you can afford that, but at the end of the day, what it winds up being is we in Queen Anne's County are sending money to the state to redistribute to other school systems that can't
Yeah.
support
And
themselves.
I think people think of Queen Anne's County as this wealthy district, but if you really look at our numbers, I mean, we have now 2 community schools.
Right.
That's huge. I mean, that's based on 100% need. We have 4 Title I schools, that's 100% need there. And so I don't know that people do realize how many needy students we have. And that they think that just across the board that we're just a wealthy district. And I don't believe that to be true as it relates to our population that we serve.
And our results, and that's the other thing I bring back to people.
Yeah.
All these other counties that are spending all their money, they're not in the top 5 every year, and the things that matter,
Yeah.
what the kids are learning, what the
Yeah.
test scores today, they're not there. So I tell people all the time, other commissioners and council people, if you want to see how to do it right, come to Queen Anne's County,
Yeah.
we'll show you how to do it right.
3 blue ribbon schools, 2
Yeah.
purple schools, we could go on and on, right?
Exactly.
A counseling program that beats anyone on the shore and in the state. Our career counseling is number 1
And they
in
want
the
to
state.
cut, and they want to cut that.
And they want to cut it.
Full-day pre-K now? in all
Full
the
day
elementary
pre-K.
schools?
We did that in 3 years. We are serving all of our pre-K students that are
All they have to do is
qualified.
just come and visit one of our career fairs that we have at either one of the high schools, or go to both of them.
Right.
Attend both of them. They're 2 separate nights, and it's amazing to see how many kids will actually stay after school and hang out to see, what options they have when they graduate high school.
Yeah.
And I tell you another one that I'm proud of, and especially from the world I come from, that worked with my hands my whole life, is when I've gone to every graduation except for the COVID year, which was, I think it's virtual then. But anyway, and over the years, it's always been, and no knock on Kent Island or Queen Anne's either way, but Kent Island, they always have all the kids that are going to college stand up, and you go to Queen Anne's, and nobody gets to stand up for like the first 7 years. But since we've instituted the career, last year, 100 kids
I know.
stood up at Queen Anne's County High School that were starting work the next day, their careers the next day. And that's a proud moment, and that should be for the education system, commissioners, this whole county. That's phenomenal. And, you
Yeah,
know,
and something near and dear to your heart, we will be bringing to the board our new electrical
I
program.
know, I heard that. It's awesome, yeah.
Next week. We are so proud of that.
So am I. I'm happy.
Really excited to, to be in
makes me
such
wanna go back to
a,
school.
to be in such a budget place where we are though, we know we constantly are looking at our programming and to see how do we keep up with our kids to make sure we're offering them what they really need. And so that's how we're able to do that.
me
We got the
certified, I'll take
space. I know, like we can do it.
I'm a cheap teacher.
That
we can
posting
do
will
it.
be going
Well,
out
I'm
shortly.
earning all this
We can
money,
do
I may
it.
retire as an electrician and become a teacher,
it.
because apparently it's more lucrative.
Yeah.
But even things like that, we have to be creative with, like to start that new program. So it's
Oh,
taking,
absolutely.
it's using grant funds to help establish it and
Yeah.
shifting things around.
Professor Jack.
I think we should have a CTE signing day.
We do, we do. And we also have a fine arts signing day, and we're coming up, because that's what is important. And so, it's, times are changing for the good, and it's a long time has been coming, right? We've all known that it's something that we needed to do, and we've been able to do it. And I know this is heavy, and, you look at the deficit, and we're gonna work through it, because we're all here for the right reason, right? We're here for the kids, and it's what we do every day. And as long as we keep our focus on that, then we're gonna be okay.
Well, it's been many, many years, and I honestly say that, I personally, I don't know, I can speak for the rest of the guys, that there's a comfort level there now, with trust. I mean, there was years where, adversaries, and we weren't getting anywhere, and I appreciate everything you guys have done, and especially in your budget and how you have it laid out, and,
The
I'm
transparency that we haven't seen in a while.
So that's,
It's been, as everyone knows, I'm retiring. It has been a pleasure working with the commissioners, 100%. I've never felt so supported as a system, and we're just very lucky. We're lucky that we have a good relationship. I'm very thankful for that, because I hear a lot from my colleagues, and it's not pleasant, and it's not right, because it's not for kids, and I'm just glad each one of you comes to the table and you're here for our kids. And it screams when you give us $7 million. It just screams at us that you support education.
Well, we appreciate you. What are you gonna do?
All of you guys.
Yeah, that's the
What are you
question.
gonna do in June?
Travel,
There you go.
travel.
So we
So,
gonna get capital yet, or no?
Yeah, I just want to say one last point about the operations budget. We can talk about capital, but I know we have a week left, or less than a week left, before your next board meeting. You're going to submit a balanced budget to your board for consideration. Your $2.6 million deficit, I think you requested, the other 50% of the pension money that we were going to pick up from the state,
Yes.
push down, to be added to your budget.
Yes.
If the commissioners choose to do that, that would get it down to
I'm-
2 million.
Sam, you got it?
We're still 2 million short.
I'm good with it, you go with it?
Yeah, okay.
You go with it?
With what?
Put the money that we're getting back from the state.
Oh, yeah.
Yeah, as long as we get that.
We can't,
So that-
I mean, it was earmarked for that anyway, so.
We were already spending it, you know what I mean?
Thank you.
That's why we're glad we're first.
All right, so,
Yeah, the rest, you could tell them on the way out.
Sorry,
they're getting
Scott.
nothing.
Sorry, Scott.
Dr. Ciatola's looking at me right back there.
we just closed the Department of Health.
Oh, my gosh.
so the second part of that question, the more difficult part, is it still leaves $2 million on the table, and we know that 85+% is salaries, wages. Are we looking at furloughs again, reductions in force? I know those are difficult decisions and questions, but, those are the things that, I think have to be
Yeah.
considered potentially.
So, as I said, we've met, and we're prepared to provide information for our board to take a big chunk out of that anyway. The remainder of that would be, and I say this, through those retirements you just asked about, where we said, are you gonna fill every one of those positions? No. So we would do it through a natural way, and we have enough people to be able to do that now.
So there will be fewer positions.
There will be fewer positions, but we would hope that no one would lose their job. Fair enough?
Very good.
Any other questions on operations?
I have two asks before we leave. Again, thank you. We appreciate you. We love our teachers.
We do.
With that, my segue is I'm looking at you, Michael.
I see the eyes.
Good to go. We're in the second year of a third year. My first year, when I walked in, was, this is from the Board of Ed, you're going to fund it. And we didn't have a seat at the table. The commissioners didn't have a seat at the table. I'm asking all of you to give us a seat at the table when you start negotiating. And I'm guessing that you do that a year ahead of time before.
We start typically around the winter break for the following year.
So can we get that commitment from you that?
You're sitting right
I
next
was
to
going
her.
to say, Beverly did say that.
Last time,
Yeah, Beverly said it.
With us last time.
We can't have a commissioner, I don't think, because we're
I don't
part
mean
of the
a
funding
commissioner.
process. Yeah.
But yeah,
I mean a financial person.
I think,
Happy to.
yeah, we'll be able to have a representative there. But
The second thing is, and you touched upon on our students, could I receive how our outcomes are? How our kids are doing, 4th grade, 8th grade, 12th grade?
Absolutely.
Thank you.
That'd be my wheelhouse.
I mean, I don't see any outcomes in here, and that's why we're here, right?
Yeah.
To have our kids have the best outcomes. So if you could send that to us, I'd appreciate
I
it.
can hook you up on data.
Yes.
Okay. All right, on the capital side,
Yes.
I don't believe you really talked a lot about capital at your previous work session with your board.
We didn't, but we
You know-
had presented to them before
Yeah.
that. So we did them in 2 different sessions.
Yeah, no, we've allocated $8.5 million to the capital budget for the Board of Education next year. We've selected all the projects that they had state shared revenue.
Thank you, Steve.
And you can,
Sure.
there's some money on the,
Start in there.
at the end of that shows you can move that around to various projects. So I don't know if you want to do all these capital projects, or if you want to work that out, that the $8.5 million was what you were
Right. Well,
proposing to allocate for
I just wanted
towards capital.
to definitely clarify that the board did get the information, they just got it at a different meeting, because it's very overwhelming to have your whole budget,
Yeah, yeah,
operating
yeah.
budget, and then the capital.
The
So
capital
we
one in
decided
itself.
to, yeah, we decided to separate that so that we could help them to, just understand it better, because it's just so much information. They completely, were on board with all of our projects and understood their order, their sense of priority, and why. We did have some changes that we're bringing to them next Wednesday as it relates to not asking for more money, but shifting money to be able to do some things that we really have to do this year, and pushing one project, a roof project. So I'm going to turn it over to Sid, and he can share that information.
Really, the only difference you're going to see is we're going to shift the roof project, partial roof replacement at Kennard Elementary School back a year, because we're actually doing a full renovation of the HVAC system. So while we have the
It's all-
cranes
it's all
in
on the
there,
roof,
and while
right.
we have the rooftop units, it's all on the roof. We're going to get a better bang for our buck, doing that all at one time. There's a rooftop cooling unit on there, so.
Which school was this?
Kennard Elementary School.
Okay.
So that's really the only change you're going to see on there.
Okay.
And I thank Jeff and his staff for working with Daryl and us on this quite a bit.
Well, it's a two-way street. We appreciate, all the information you've provided to us, and it's been very, very good partnership. Very productive. On these capitals, so, good. All right?
I mean,
You good?
that's a, capital side, Board of Education's never a struggle.
And I appreciate, and I always say
We
that.
do. We do
I'll take whatever you
appreciate
give
it,
me.
Yeah.
It's only a struggle from the standpoint, they really need about $20 million for the
Yeah.
capital plan, which we really
Well, he
can't.
got that wet bar in his office.
That's good.
Oh, my Sid.
All right, very good.
Thank
Thank you
you.
all.
Thank you, everybody.
Thank you.
All right, next we have Department of Emergency Services.
Library.
Thank you. Oh, I'm sorry, library. Library.
Hey, try to work with Rick, will you? Thanks a lot. Appreciate it. And if Robbie Black gives you any shit, let me know. Okay? you know, a lot of time and money went into that field, we gotta maintain. Right?
Sir.
Hang in there, Doc.
Will do. Thank you very much.
Oh, thank you. Appreciate it. Yeah, no, great.
Thank you, guys.
Good work.
Welcome.
Good luck.
you.
Good luck. Yeah, you're welcome. Right? Time needs to go, right?
What's up, man?
I brought in the colored version that we got last night.
So we got
Oh, that's
DES
half a
next?
penny right there.
You said DES?
I'm sorry, library.
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 Library's next.
Library, yep.
I was just gonna say, follow your tabs there, Cappy.
I'm just curious. You got it.
We got the decent ass. Thank you.
Tell Dave it's getting close to golf season.
Yeah, I've got carpal tunnel by day for scheduling, so you can still go. You're good.
All right, Jeffrey, take it away. Library, okay.
Next to the library, which starts on page 62 of your work session book. And library comprises only one line item in our budget, requesting a $142,000 increase over last year, which is 5%. On the next page are their enhancement and new position requests. And I didn't know if the library, Janet wanted to review these quickly. Commissioners, your new position requests and
Sure.
enhancements.
Well, first off, thank you for the budget that you gave us, because that's a really awesome in this year. I wasn't sure what we were gonna get, and I was like, thank the Lord, we got raises for the staff, because that was the biggest thing. So thank you. I appreciate the budget you gave us and the increases for inflation that we're facing, and thank you. I could sleep better. But there are some things that we need on top of that, if you can find it in your hearts to give us more money. As you know, our makerspace is fully open now and very, very busy. Since December of 2023, we've had a 519% increase in the number of projects that are going through there. I mean, people are just, now that they know it's there, it's like gangbusters going through there. I mean, the students who come into the Kent Island branch after school are there all day, or they're there after school, and they're doing projects, and just people from the community are coming in. One of the biggest projects that seems to just be taking off is personalizing your own charcuterie board. People are giving that as gifts, you know, like at Christmas time and stuff. So, I mean, there's lots of different things that are happening in our makerspace. We do have 2 full-time staff who are there, a full-time supervisor and a part-time person. All of those people also spend time working in the Kent Island branch. So we don't have our makerspace open all of the time that the library is open, just because we don't have enough staff to do that. So it is open Monday and Thursday, 1 to 7, Tuesdays and Wednesdays, 12 to 5, and Fridays, Saturdays, 2 to 4.
So do you guys need to know what that makerspace is? Remember when we had a commissioners meeting a couple weeks ago? It was that classroom right across the hall from where we were?
Yeah, where we have the engraver and the resin maker thing.
It looks like there were several projects in
There are,
their process sitting there.
there are.
I think one even said, "Don't touch." It was a little, "Don't touch."
And you did, didn't you?
I did. No, the door was locked. I couldn't get in.
You wanted to, I know he did.
Well, there you go. So if we had another full-time person, we would be able to open it more on, later on Tuesdays, a little bit later on Wednesdays. We'd just be able to have a few more hours for it to be open for the people who would like to be.
So right
in
now,
there.
it's a part-time position. It's open 3 days a week?
I'm sorry?
Right now, it's a part-time person?
Right now, it is a full-time supervisor.
Okay.
2 full-time staff members and a part-time person in there during these hours. And it really takes 2 people being in there when there's lots of projects going on and when there's students coming in all the time. So this would just allow another person to help us and stay open later on the days that we're not open past 5.
We'll let you know.
I'm sorry?
We'll let you know.
I know. Also, we're asking for a full-time outreach associate. We do a lot of outreach in the community. The mobile library has really increased our visibility, so people see it, and then they want us to be everywhere, which is nice, except that we just don't have staff to do that. So if we could have an outreach associate, that would be helpful. In FY23, we did 40 outreach events. In FY24, we did 66. I think we're already up to like 50 for this year,
So
and we're
give me
just
an-
going into the big season. So there's just having another, right now, our only outreach person is our outreach and marketing manager. That's the only person who actually does outreach in their title.
Okay, so give me an example of what outreach is.
Oh, so that would be like going to the school spring thing. That would be the,
Go to the 4-H
going to
fair.
family, yeah.
What is that?
Going to the fair. It's going out to the schools. It's going out into different community events.
Letting everybody know we have a library.
And yeah,
Marketing.
signing people for library cards, hopefully, so, yeah.
And you
that's
have
what
currently
outreach
one
is.
person doing that right now?
We have one person who does that as her job and coordinates other people, other staff to do those things. But if it's a very busy day and the staff are busy in the branch, it's hard to get people to go out to do the outreach. The mobile library has 2.5 people who work on there, so they can only do so much too. So just having another full-time person would help us ease some of that burden and also help us do a few more events, because we do have to say no to people. We just don't have enough people to be everywhere all the time. And that's what people seem to want us to do, is to be everywhere all the time. And then Kent Island is also requesting a part-time youth services associate. We did a strategic plan survey a while back, and one of the things we were hearing over and over again, and really just recently it's been coming back and back and back at us, is we don't have a whole lot of programming for parents who work during the day, like their kids are not being able to come to library programs because most of our programs happen during the day. So this would allow us to expand some of our children's programming more into the evening. So those are the big three. I know nobody's getting new positions this year, but if you find it to give us at least one of these positions, that would be helpful. Makerspace is probably the most important one right now, but I would take any one of them. So I appreciate that. The other big thing that was not funded that I would like to talk about is the Empowerment Library. The Empowerment Library is a partnership we have with the Queen Anne's County Detention Center, their library. A year and a half ago. 2 years, oh my gosh, it's been that long. We got a grant from the Maryland State Library Agency to help the detention center library refresh their library because their books were in really, really bad condition, and there was no funding for them to get new books. So we got a grant, and we said, we'll go through, we'll look at what needs to be tossed out, and we'll help you curate new books for.
Where was that, I'm sorry?
The Empowerment Library is on page 65 in the binder. It's just at the top.
Oh, where was that?
It's at the Queen Anne's County Detention Center.
Yeah, okay.
So we have staff who went in and helped them, and then we've been purchasing books for them, and those books get special bookmarks put in them when they're checked out so that we know how many people are using it. And it's been a really, really successful partnership. We put 654 books the first year we purchased for them, and they circulated 1,451 times. Now, last year, we didn't ask for any money from the Empowerment Library because we were expecting to get grants for them, and we didn't get any of those grants, which was surprising to me because it's something that is actually a big push in libraries right now, so I was disappointed not to get any of those. But we got a grant for something else, so we reallocated that money to pay for some books at the Empowerment Library in this fiscal year. But going forward, if we could have any part of that $10,000 I'm asking for would be really, really great to help keep going with the books. What we've heard from the detention center people who are incarcerated there is that it's a very positive thing for them. One of the comments was that I've discovered a new passion I never read before, but now I have this new joy to carry me through the rest of my life. And the books are helping keep my anxiety down about the uncertainty of my future. All of that's good. And even the management at the detention center has said there has been a decrease in animosity, and their things are a bit more calm because they have something else to do with their time. So that would be the other thing I would really push for, is if there's any money that we could put towards the empowerment library, that would be greatly appreciated.
And we have had people stop by the library after they've been released to thank
They
us,
have.
so.
They
It's
have.
been nice, yeah.
Any success with grants? You just.
Oh, when
Grant?
we've applied for several more this year as well, so if we
And
get
any
them, great,
success?
but
Okay.
it doesn't always go. so.
So they're for later in the year? You've already applied for them, or you received?
We're applying, we have not received.
Did you receive
Where,
any?
where,
This-
where their budget is they asked for the 10 grand to buy, is that to buy books?
Yes.
And replace foreign books. yeah.
65?
The top of page 65 under C, material increases. So it's a subsection of that 26,000.
Okay, I got you.
So a grant was applied for this fiscal year, but we
That's the
didn't get it.
empowerment library you're
And
referencing.
currently, someone's applying for a United Way grant to see if we can get something
Did
from
you get
them.
any last year?
And we've applied for the Inshore Community Foundation. We've applied for one of their grants, but we haven't heard anything. We
Our friends
applied for
group
our
is giving us a
libraries
thing.
Transform Communities grant. We didn't get that one. I mean, we're applying for what we can get. We also asked the Friends, and we will ask the Friends for some money, our friends at the library, for some money as well, but a little bit helps, so.
Yeah, and this year, we had all the agencies met with our grant writing firm to express their needs, so we have, additional outreach through 11th House to look for various grants that are necessary for
And
our
I'm meeting
departments
with your
and
grant
agencies.
person
Yeah.
in April, so.
Yeah, so,
So they're reading all kinds of books.
We get
Yeah.
requests from them. They actually write down their requests and we get them.
And a lot of it's like personal self-help or workforce development kind of things, and just,
Prepare themselves for when they do get
For
out.
when they do get out.
And the bookmark actually has information about the library and resources that when you get out, you can come over there and apply for jobs. You can get help with resumes, so it's all
And
on
when
the
they
bookmark.
leave, they get a little packet that has a library card application and like a little book to keep track of things that they need to remember when they leave and where to find the resources when they get out and all of that stuff. So it's been a really good partnership, and we would like to continue it, but it needs money.
all right.
Going
Does
over
have
to-
any questions?
Thank you. Any questions? or-
Thank you. And again, thank you for what you did put in there. I did have a question about the capital budget, though.
Sure. Okay.
I see, I was looking at your PowerPoint that you presented, Todd, and in the capital budget, it didn't look like there was anything in it for FY '26, so I just wanted to make sure that we were still getting that 110,000 for the upgrade to our fire alarm system and access controls, because in the PowerPoint that was presented, it wasn't in there, and that's why I just wanted to make sure that it was just maybe split over by one by accident.
Yeah, we pushed that 40-year because there's $180,000 already existing in that project from prior years. And we were
That's-
hoping thinking that could be put towards your,
So you got prior year fund balance, it looks like, for 180,000.
180,000.
That's for the parking lot, which is supposed to be done this year.
Yeah, we had consulted with Public Works on that, and they said the fire alarm system's working fine. So we wanted to use, that money for the parking lot next year, and then push
okay.
the fire alarm to the fiscal '27.
All right, well, that explains that.
Pushing the year.
Because I was like,
So, yeah.
okay,
So what, we're doing the parking lot first or fire alarm first?
Parking lot.
the parking lot is in desperate need
And the
of.
fire alarm will be next year. Yeah.
They said it's working fine.
I mean, it works, yes.
It does work, and that's a good thing, so.
See smoke? Fire.
One, get out. That's how it works.
Grab as many books as you can on your way out. Did you just say that?
I did not.
So it's still in the capital budget, but just we pushed it to FY '27. The fire.
Okay, thank you. I just wanted to
Yeah.
clarify that.
Information that we presented in the PowerPoint only identified FY '26 projects that we were going to consider for funding in FY '26 for next budget cycle.
Okay,
We'll keep it in there for the future years.
thank you.
All right?
Thank you.
Well, that was quick.
Thank you, ladies.
All right, thank you
Thank
so
you.
much. Yeah.
you already did? Okay. For Mondays.
All right.
If you want to send in those
Oh, they are?
folks with the white shirts and the badges,
Ones that are all on their phones.
Oh, I will.
if you want to send them in, tell them their boss is already in here. Jesus.
That was my recommendation. Well, right, exactly. Because we had 22 requests.
Yeah.
I mean, yeah, so.
Yeah. 2 hours, takes care of it.
All right.
There he is.
I'm glad you still love me. Is it okay if I sit
I
next to you?
always, of course, I did it just for you. No, we're not.
That's all right.
No, you have to sit here. I said you have to sit here.
No, I don't. You guys know our budget better than we do, so. Hello, hello. I mean, the biggest chunk of it, so it doesn't matter.
I don't care, I'm gonna talk as much as you. Stop doing this.
Yeah, but you do know.
Floor is light.
Someone's got a light.
Amoya. I got shaving cream in it.
It's my snack bar over there.
I forgot about it.
I want to hear more about the swim charcuterie boards over in the library.
To see.
Yeah, I know.
We're doing that.
Been a while. Been a minute.
It's been a minute.
So, the board told you guys on the way out, there's nothing left, right? They took it
Yeah,
all.
they took it all. Yep.
Every time.
As long as there's no expectations coming in here, that's all.
There is zero
We're
We're just here for table scraps.
Hey, but you know what, at least you.
That's like
this
saying, what
time
am I
you can't
doing
go-
here,
You
right?
can't go to the next FEC meeting and say, I got beat up because I was the last one in the room after everybody got all the money. This time you're at least third, so you got a shot.
We're like a good dog. We're just happy
Small
whatever
shot.
falls on the floor.
Very small.
What's that?
It's like a good dog. We're just happy
We'd like to
whatever
help
falls
you
on
out,
the
but we
floor.
just gave you all the library.
Well, they seemed awful happy when they left, so.
They ran it out in like 10
But-
minutes.
Patrick said,
But we don't have a Department of Health.
Ran it out.
Patrick said, we have a library?
We don't really have much.
I hope so, but
Who wanted to do that?
I said, we have a library?
Go right through this.
Get back on schedule.
Roll right through.
Kidding, where?
Got a feeling this is gonna be a long evening.
6:30.
Yep.
It already has been, Scott.
So we just took an hour on the first one.
What's up, Section 200?
All right, ready to go? Hoping to be somewhere in the middle.
They're the
Yeah, let's go.
All right, we are the biggest chunk of the pie.
All right.
I gotta say, man, about a horse.
ES starts on page 68 of the work session book. This is a roll-up summary of all the DES divisions, showing requests by account. Just a few quick items. Let's see. Increases in user fees are simply reflective of prior year actuals. Line item for mobile integrated health, that's been zeroed out. That's simply been moved to the grant fund, so it's not that, that funding has been lost, it's just moved to a different fund. Salaries and wages and benefits are built in, not really much to say about that. On the next page, we have
Yes.
expenditures, and again, nothing really material to speak of. Their total increase for 26 is 7.3%, which is below our threshold set at 8.8. So, yeah, I didn't really have anything other to say about their operating budget than that, unless Scott or his team have any comments they'd like to make, or if you all have any questions, specific questions.
Well, the only comment I make is Karen was fantastic to work with through the whole process. We're very appreciative that you put up with us during the whole process.
That's not what she told us.
And
One of my
on,
favorites. Don't pick one.
please listen to her. And on the Jeff Todd side, I think globally, for all the departments, they made a very fair budget, and we really don't have any complaints or.
You don't have to suck up,
So I have a
Scott.
question.
You're good.
So I have a question. In the early months, you present a wish list or a budget to Todd? And then he takes a look at it, and he says, no, 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 and then gives it back to you and says, rework it? Or he gives you his budget back to you, and then that's when you two get together and?
Well,
I want to know how we got here today with DES.
So how we got here today is we created, as a team, we created the budget. Kelly is our brains for all the divisions, and each division creates their own budget. We try to submit something to Jeff and Karen that's on the modest side, which they probably sometimes laugh at what we consider modest. Then there is a meeting with the finance director and the county administrator, and we basically roll up our sleeves and go through the budget, and they hit every single line item and ask us what it's about, what we need, what we don't need. And then about 2 weeks later, Karen will send something to us and say, this is your rough draft. This is what you got.
So do you think that, and this is to put you on the spot, do you think this set of commissioners has been pretty generous to DES over the years? Meeting the needs of our citizens?
Been beyond generous.
Okay.
So you have definitely, if we said we absolutely need something, you have always found a way to help us and get what we absolutely need. So I think out of our whole group, we don't have any complaints.
So I got one.
Complaint or a question?
No, it's a question. It's a question.
He's allowed to complain, I'm not.
Oh, you can complain, believe me. It makes us all better. So looking forward, probably more directed to you, Zach, but Scott, you obviously is the head. So where are we at on paramedic units? When are we going to be behind, if we're not already?
We're bordering being behind right now.
Don't you have a unit already that just hasn't come yet?
No, I'm not talking about physical units. I'm talking about
talking staff
location
trucks.
units, actual staffed units.
Oh, okay.
When do we have to add another one? I mean, I see the call volumes come in. And
I know you guys see the reports.
I love seeing the big dips because I'm like, oh, cool, we're good. But then I see them 190s come in for like 3 weeks in a row, and I'm thinking, we're not as good as we were. So, and then obviously being on active 911, I know when we have ambulances that, we have no ambulances basically. They're all busy. But, I mean, when do we, I mean, if we got to start preparing for it now, let us know now.
I'm pretty confident by next budget cycle, that's one thing that we're going to be looking at really close.
Where are we thinking we're going to put it?
Well, the interesting thing is
200.
we're in conversations with Graysonville Fire Department right now as a potential site location. Unfortunately, about 3 years ago, we put an extra unit in service, and we didn't really have a site to put it, so we put it on Kent Island. And right now, that unit is so busy, if I move it anywhere else, it's going right back to Kent Island. So if we station it somewhere else, it's going to be continuously transferred to Kent Island. So if we want to crew another area, we almost have to add another unit. And we're to the point, you see our stats every week, Zach produced our stats out to you. It's rare on a weekly basis that we're not down to 1 or 0 units in county available at any given time.
Yeah, when you look at the EMS call volume, about roughly 50% of it is south of the 5301 split, and of that 50%, looking at global population, like 35% of the total call volume is in the Kent Island area. So whenever we have only one unit on Kent Island, if that unit's going on a call, then the next unit's either transferring down or running their call down there, so.
So are you implying that you keep the one at the Kent Narrows and add the other one at Graysonville, or you keep the one at Kent Narrows and add one on Route 8?
So there's
Well, what we're
there's
saying
two on
is-
Route 8 right now. We don't have a unit. The Kent Narrows station has a EMS supervisor there.
Okay.
There's 2 on Route 8 and then 1 in Queenstown right now, so.
So you would
Yeah,
think somewhere in
Graysonville, we want something in Graysonville and then preserve 2 on Route 8.
Gotcha. You would move those, but that would take care of your,
Which one in between, basically?
Yeah, and it blunts where the majority of the call volume is, so that's the sweet spot.
So we need to know what that's going to cost.
because you have 6 now, right?
Yes.
Yeah.
We started with 4.
4.
Yeah, up to 6.
We had
In the MIC
500
unit.
and 200.
Yep.
In the MIC unit.
In the MIC unit.
That's right. Okay.
So, but I would say, Scott, correct me if I'm wrong, next year start, definitely in 2 years, we're gonna be well.
We're
Well, thinking about.
Well, we don't want to
starting
get,
now,
we
so-
can't get behind, because as long as it takes to get ambulances in, we need to prepare for this now.
And the
No-
build-outs, with a lot of these subdivisions that are, putting the bows on and finishing up, it's certainly gonna have a huge effect on call volume in the next couple of years anyway. I'd
Well,
rather
the-
that we be prepared instead of,
Well, the interesting
duct tape
thing,
to make it work.
our next update, I think, is in 2 weeks, our quarterly update. One thing that we're going to show you in our quarterly update is we now have the ability to show you online stats, like the community can just log into our system and see current call volume that we're running. And the interesting thing is comparing the 55 and older communities compared to regular communities and how much that impacts our system. And Ellendale's the best place to look on the stat generator that we have that you'll be able to look at, because there's a community that's family-oriented, younger, and then the 55 and older right beside it, and the call volume is triple.
Well, these people got to start reading the sign when they go in. It says active adults. They got to start getting active so that they're not going in ambulances. That's pretty simple.
Lift assist.
Wow.
Call.
It is, yeah. How many, I'm glad you brought
can
that
say
up.
that.
How many of those do you get a week, in all honesty?
Lift assists?
Yeah.
Oh, I don't have the.
It's
full
our third
number in
highest
my head,
call,
but Yeah.
Wow.
It's your third
statistically.
highest?
Yep.
Yeah.
Really?
Sometimes it scrapes in there second highest, but it's the most frequent call that we
If you
run,
combine
basically.
lift assist
So you
with
need a
falls, you would
unit,
get.
what I'm hearing you say is you need a unit at Four Seasons.
We almost need a unit, run around and do lift assist all day.
I'm just going to lay on the
Just do lift assist, we
Oh, yeah.
quite a bit of them.
Yeah.
Could that be farmed out to Independence or no?
The problem is, it's not really a billable service, so independents are not gonna touch it with a 10-foot pole, basically. And the fire departments are really overrun with them right now,
It's breaking their
so.
back too.
And that's part of the SOP that I always hear about in the FDC is one of the things is it's like what you got to send for a lift assist, what you're taking out of the house.
And
just
how
to go-
often?
Well, yeah, if it's a number 3 call, means you're taking the volunteers, getting them in a truck to go out there for a lift assist.
Yeah.
And there's no better way, huh?
No, unfortunately, there is not.
The only thing we could do is,
But what does that lift assist cost?
It,
I'm thinking,
The fire
as an
department costs
entrepreneur, you sub that out to me and I run everywhere to pick
Tim's
somebody
going to go
up.
get a bunch of college students. You're going to just hire them to get out there and
Just
pick
think about it, you
people up.
know, if that calls out.
The hell with
$1
college
an
kids
hour,
moving
but
trucks, we're gonna,
yeah, I
Don't
think
tie
there's,
up your emergency services.
I saw an article in EMS one about some jurisdiction in the south that was charging, I think, $500 a lift assist.
But I mean, it's costing you something when
Oh,
you
yeah,
get
yeah.
somebody out of there and they're no longer in service dealing with that.
Yeah, I mean, the
I mean,
biggest
it's like
cost.
the MIC unit, you got the MIC unit for people who are sick, you got the lift assist for people at night and, you know, they're,
Well, you're running that fire truck out every time.
but that's my point.
But they're not even seeing that cost. That's an additional cost because they don't, the
Yeah.
gas and all, just to run the fire truck out there for a lift assist.
Yeah, so, and Mick works pretty well. We've been able to mitigate some of those recurring lift assist calls by working with community services and the health department to put in like ramps, stair lifts, things like that. We've been able to blunt some of them, but there's some of them that are just lifers, and there's nothing that we can do other than just, when they come, we pick them up and put them back in bed.
When you go to the ER, is our response time getting better, that they're allowing us to drop the patient off and come back so we can put that unit back into service?
I'm proud to say that we led the charge on that for all the jurisdictions in the surrounding area.
Yeah.
And it has gotten better. It's still not where we want it to be, but it has gone from 2.5 to 3 hour wait time to 30 to 45-minute wait time, which is a lot more acceptable.
Yeah, it's gotten better. Anne Arundel has done a very concerted push to try and turn over their times, and Shore has done that as well. But it's just like the call volumes, it's cyclic. Like, there's some weeks when they're busy and we're busy, and we're seeing those times creep back up to
We're losing.
45. Yeah, and
Send it to the emergency room.
yeah, I mean, the problem that kills us is just the distance of, like, we're sitting in the emergency room and then we still have a 30 to 40-minute drive depending on traffic back.
you get back in service.
So that's what the real killer part is for us.
And we're still one of the 2 counties in the state of Maryland that don't have a hospital within our border, so
Yeah, and
it makes it difficult for us.
for us,
The new one will be a little bit closer.
A little bit closer, but I'm very concerned about the size as they're building it and how the spoken hub is actually going to function. So
What do you mean?
it's,
A conversation for another time.
Yeah.
Conversation for another time.
no, that's important.
I know, but we'll be able to.
We can talk about that during our update,
During what?
when we come for our update.
Okay,
Anything else?
Yep.
Capital?
Capital.
down to capital?
Quick question. The FY '24 actual and the overtime, we got 1.3 million. That's telling me we're short-staffed.
Yeah, that was with us putting a new unit in and trying to clear folks, so it just took a long time to get people in. You've seen that number kind of stabilize a little bit in FY '25.
Okay.
Page 54, the capital book is the beginning of the emergency services projects. Let's see. Scott, I didn't know if there's any that you want to highlight specifically.
So real quick, those are the individual projects, right? So I leave through, where's the roll-up back in the front?
It's in the front, yeah.
You want to refer to the roll-up, or?
Probably easier to kind of flip through.
Okay.
The, starting on page 54. First one being replacement vehicles, 1 ambulance, 1 supervisor unit program for next year. No changes were made to this submission. Next one, EMS emergency equipment. Scuba protective gear, 176,000 program for next year. I don't know if you want me to go one by one, or page 57 is the radio tower inspection repair. During our meeting, I think, yeah, you had 15,000 programmed, but there's a prior year balance of 13. I think you all said that would suffice for next year. Is that up?
yes.
Cardiac care equipment on page 58, 101,000 program for next year. Yeah, please stop me if you want to jump in or anything and add anything, but
Any questions on any of this? We're prepared to answer them.
page 59, public safety network, for 90,000 program for next year. Emergency plan update. Funding was removed for next year to use the prior year balance of 128,000. Radio subscriber replacement, 200,000 programmed. 911 center refresh, 2.4 million, all grant funding. 911 board.
What is PY balance?
Prior year.
Prior year, all right, should, no.
So is that what's still in there, or is that what was used? That's still what's in that?
Okay, when you see it in there, that's,
I got you, okay. So is that where you're zeroing out some of the stuff? It's not, there's not something gonna be done with that, Jeff? It's just that there's
They had a-
fund balance to cover, okay, all right.
And it's not
Some of
already
the,
earmarked.
some of the deceiving stuff for us from prior year fund balances, like the radios
Right.
and other equipment, we're still experiencing 12 to 24 months to get things in once we order them. So we still have things that are on order from prior year that we haven't even received shipment-wise.
All right, page 63, the voice recording system, 740,000 programmed, again, grant funds, grant funded.
The iPads and the systems in the volunteer fire trucks, their systems are constantly upgraded, the iPads that they're
So,
using for,
so that component is within their budget, that's not through our budget, just the iPads on our units are in our budget.
but they're on-
It's
but they're on the same
been,
system.
We're on a similar system. So the difference between what we run in our units and what they run in theirs is they have an iPad with a wireless card built into the iPad. We have a black box mounted in our units that one gives us GPS location coordinates. It also ties into all the area hospitals so we can transmit ECGs and other information to the area hospitals. So ours is a lot more complex than theirs
They
is.
don't need that because they're not going to the hospital, right?
Correct.
Yeah.
So, so their system's a little bit different than ours. I believe they're probably at the 5-year mark for their iPads, so they should start considering
Yeah.
replacement, but they shouldn't do it all at once, so you're not constantly replacing the whole system every single time. They should start trickling in replacements throughout, but that's something they need to work out with the IT department and themselves, and they have a line item within their budget for that.
Thank you.
Okay, page 64, emergency services building, no funds programmed until 2028. Next, Motorola console upgrade, no funds programmed for next year. And finally, the radio amateur civil emergency service, 15,000 programmed for next year. And those are all of the DES projects. Any other
Any
questions?
questions on
Yeah,
the,
where did you put the animal control aspect of, or what we're moving out from them to?
that's an operational budget item. It's compartmentalized within emergency services, so we're going to transition that over the next several months and then have that transferred over to animal services July 1st. So it's an operational piece.
Okay, so there's no.
Is it in
no
their budget,
funds-
though?
Funds tied with that? It's just the move,
Oh, yeah.
the money moves with them and?
No, it's in here. It's in their
Yeah.
budget in here.
Okay.
It's always been separate.
Yeah, it has its own budget, so they're basically just lifting that budget and transferring it over to animal
Just transfer,
services.
yeah.
Okay. Enough said.
Anything else, commissioners?
We're good.
All right.
We appreciate your time.
Yes,
Hi,
indeed.
Jeff,
Thank you.
thank you for everything.
Thank you very much. Yeah.
Karen, I owe you lunch and a few other things, but you've taken great care of us. Thank you.
All right.
And so you think you can have us some numbers for when you come to do the update in a couple weeks? With the ambulance and calls and where it might go and just preliminary, nothing solid?
We can put something together when we do our update for you.
Have it together.
All right.
Thank you very much.
Thank you. Thank you all. All right. Okay.
See that overtime? A lot of that is just because it gets folks that are outside.
Huh?
Their overtime number was like 1.3 million. Overtime.
Of course.
Hadley had 2 home runs.
Good evening, ladies and gentlemen. Hadley hit 2 of them. Hadley Rushman hit 2 of them. So it was big. Beginning of the season. Hadley Rushman's he's hitting dingers early this season. Then he.
Figure the young boys would stay in power, but they don't.
How about Jackson Halliday?
Gunner did second. Gunner's out.
Yeah, he's still injured. Yeah. What about Halliday?
He's on 15 days.
DEN.
He's on 15.
DEN.
Oh, he got hurt.
For 5.
Jackson Halliday went 1 for 5. What was it? A single? Does it say?
At least he's hit.
I mean, it's too hot.
Struck out twice.
Listen, you go to bat 10 times, and you get 4 hits out of those 10 times. You're batting 400, and you're a hero.
He needs 2 more hits next game, so.
Oh, you can do that.
Or he's a good.
I haven't seen you for a while.
It's his striking.
Congratulations.
Yeah, he looks Batista.
He's back this year?
Yeah.
I thought it was like that. He's all over his head. I saw that.
Yeah, he looked good in pre. Yeah.
I forgot my glasses.
Major.
Hello?
Try
you
that?
heard me?
Want to try that? No. I hear you.
Let's see if it works. There you go, sir. Here you go.
I'll be able to see you, but I heard you. Try him.
No, God.
Oh, really? It's like that.
2 weeks?
Oh, it's definitely like that.
Thank you, though.
What do you need, 1.5s or?
2.0s, but I'm good. I just-
Under 1.25.
It's horrible.
Don't need them to shield, isn't it?
No, we have good dot, so we're good.
I gotta see you there.
Do you want
General direction.
Karen to zoom in? She
I don't
said
know
she
how
can
to.
zoom in.
I can see that easy.
Oh, good. All right. Well, Commissioners, thank you for saving the easiest budget for last. I appreciate this. And
I don't know, you get the highest jump.
You get the largest increase.
Everybody else was.
And you and I talked about this. You traditionally have come in flat.
I know,
You're
this
at-
is like the first time in my,
Tenure?
legacy of sheriff of being, requesting a lot more. But, or
So-
You're
coming
carrying
in.
the courthouse in here, though.
This is the big issue, though, yeah, it's the legislation for the courthouse. And it sounds like, from what I found out today, the one bill didn't make it, still in the drawer, like you said. And then the other bill's gonna be reworked, so that they're gonna be collecting data on courthouse incidences and things like that first, before they make the requirements, so.
And
that
what
was
about,
gonna-
what about the two deputies? Is that part of it that was
That was part of
tabled?
it. Mhm.
Okay.
Yeah.
So we think that's gonna be next year, you think?
Yeah, I do,
Okay.
yeah. So I think we're good, so I think that's gonna help us get our budget back down to, a manageable flat line like it's been for the past,
Well, just like DES, a lot of what you guys do comes through grants. And phew,
let me tell you what.
God for that.
Public, thank you to Major Amoya for his, grant writing skills, because
state
he is good. He is good. And then Major Boardman's, working with your grant writers as well to look for some more funding, so, I mean, if it's free, it's for us. We love free stuff, so.
Yeah, but you have 23 other jurisdictions that are trying to do the same thing.
Right.
Yeah, but
And the grant
there's
funds are
no,
getting tight.
Yeah.
It's gonna be president of the
are we,
sheriffs,
are
he
we,
gets favoritism.
are we live? There's no place better than Queen Anne's County, so, and everybody knows that. So, and we're one of the safest counties out there, thanks to what everybody does, and so that's good. That's why everybody wants to move here.
So, I mean, your budget is literally the courthouse, so if that goes away, which
Yeah.
it's going away. This year, yeah.
This year, yeah, some we're going to revisit next year, absolutely.
But how many did you have? It's not two, right? It's
Four, it would have been four
right?
positions.
Yeah, that's what I thought. Yes.
So,
4 plus, we have a clerk position, right? Also, that's good with that? Isn't
Oh,
there
yeah, there's a clerk,
position that
and
goes with that?
and isn't there another assistant? Isn't there
Jury
another
commissioner,
assistant
bailiff,
district attorney?
and potentially another, prosecutor for
Yeah,
the
another
state's attorney. So
prosecutor.
maybe up to 5 for a second new judge.
In the
Yes.
sheriff's department now?
we have some vacancies, so we're pushing 82, right, total allocated positions.
For sworn, yeah. Total manpower with civilian plus sworn, 100, give or take.
Oh, okay, good.
That's allocated.
Right.
And then about 10 to 12 volunteer deputies, auxiliaries. So it's quite larger than,
I got sworn in today.
You guys sworn in today?
he did get sworn in today, Jack did.
Oh, yeah?
Yeah, congratulations. Yeah, he's on our
I've
bike,
been sworn out.
he's on our bike patrol.
Ah, there you go.
Gotta get a bike now.
No, we have
Put it
we
in,
have bikes.
line item it, put it in the budget.
Hey, we got bikes on a grant, so we're good.
So sworn officers and what?
And civilian, total,
About 100.
it's about 100, it might be 101. I don't,
You say total civilians.
16.
like non-sworn.
16, thank you. That's
Not sworn in.
That could be like the person who's processing evidence, the quartermaster.
Sure, yep.
Positions like that, and that's one of the things that we did when we first came in, was we converted a lot of those positions before were sworn positions. So it was easier for us to put them in as civilian positions. So we've tried to, anywhere we can convert it to a civilian position, we're doing that. We have been over the years.
We have about 8 vacancies right now, all on the sworn side. We don't have any vacancies on the civilian side.
How many you got in the academy right now, though, that are coming through?
You just had a class graduate, didn't you?
Yes.
You have 5 coming?
And then we have 4 in the, we have 4 in the academy right now.
Oh, yeah, that's right.
2 and 2. Yeah, so we have 4 in the academy right now that should be graduating in June.
So when you get that, just say that's gonna cut it in half, but what's your attrition on the other side? Like, what are
Well,
you losing?
those aren't counted in the 8 vacancies.
3.
Oh,
2 to 3.
is that kind of?
Well, 2 of them are potentially leaving, coming out. One's
One's leaving in April.
and then there's
talk for another one later.
Another one's probably leaving in May. They moved here to work away from family, and family has called them back for different issues, so. Both of them, pretty much the same reason for both of them. One's going to be moving back up to Connecticut, we believe, and the other one has already put in his resignation. He's moving to Salisbury or Ocean City, somewhere down there.
So, other than budget stuff, how's the recruiting going?
Good.
I mean, it's sworn officers that are leaving the one jurisdiction to come here, or, I mean, where we
You see a
getting?
mix of both of that. We see a lot of new applicants getting into law enforcement.
My neighbor.
Because
My neighbor.
we're safe. I mean, it's a good kind of work, and a lot of parents are encouraging their kids to come work here in Queen Anne's, because they know it is a safer jurisdiction, and the public appreciates us. That's the big thing. I mean, they really like the police here. So that's, kind of gives families a comfort level versus families talking somebody out. But we do see the occasional jumpers. I mean, now with LEOPS, the pension system being something that they can take from one jurisdiction to another.
They don't then, right?
No, but we do see it. We have a couple that are taking the pension with them, because they can go from here to another jurisdiction and take that pension with them, so that does.
Compared to 2 years ago, we were seeing a lot more, and now it's subsided.
Our retention is I'd say our retention is probably one of the best in the surrounding police departments, or if not the best, because we do not lose that many deputies once they join our ranks.
It's good. It's good to hear.
I mean, you're always going to lose some. I mean, like situations with family and things like that, or people want to get out of law enforcement or do something different. But, I mean, it's tough. Now it's tough trying to recruit law enforcement. I mean, who'd want to applaud the ones that do? Yeah.
Well, I know a few years ago we had a real tough time, but I think we made some adjustments in the packages, and I think hopefully that's worked out.
You all were really good to us on.
And we had to do the same with DES too.
Yes, absolutely.
Because we were getting robbed blind, from other jurisdictions that way as well.
They take the good ones, take the good ones that they can poach. And good. Yeah, you all were great to us with the salaries and helped us get up to par where we need to be. So appreciate that.
So is the LEOPS jump from
404 and 309? Yes. Are you guys going to be
That's
able to
the one
use
we
it?
use.
That's the one we use. I'm saying, did you see the one they're building?
Yeah, it's the
indoor?
same location, but
Yeah.
they're renovating it and making it much larger. There's going to be a right.
They're tearing down the old one anyway, right, to get back there, because the road's all closed. You can't get back there now, right? Yeah.
You can get back to the range, but you're limited. All the new buildings going up right now for indoor portion and
Right.
250 yard.
So the indoor portion will be closer to the road, is that what it is? And then on the backside? Gotcha.
Your question, sir?
Do we need a range at the new jail?
The new jail?
We need a what? You say range?
Firing range.
I don't think I'd put that next to a jail, would you?
Sure. Got 80 acres.
Inmates can hear gunfire all day long? I guess that's
We're all good at sharing
soothing.
stuff. DNR does let us use the range, and we got a good agreement with them on that, so.
Yeah.
It'd always be nice to have our own range. I mean, we'd always love to do that, and at some point, we may be forced into that. But at that point, we'll cross that bridge when we get to that.
There's a lot of environmental problems when you're
Yeah.
in range too that you have to
Lead
consider.
abatement.
Yeah.
Corps of Army Engineers has to come in and evaluate everything, and lead abatement, all that.
I know somebody that does the lead.
That's if it's outdoors.
Yes, sir.
Yeah.
Big money in that.
Oh, yeah.
Sure.
He says crazy.
Yeah.
They got to dig 8-10 feet in, depending on what the rounds were.
Put the bladders in and all.
You didn't have to, on the old ones you did, you just went in there and, I can't remember who he said what it was, ATF, or not ATF, it was one of the agencies that did it though, but it was their range, they went in, they pulled it out, they had to sit there with hand sieves for like 8 hours and
Wow.
sift through all the sand, because they had to reuse it and all that, and get all the lead.
Let out.
When you think of the contaminants from that lead over the years that seeps down, so, yeah.
But I think now they line them like
do.
dumps,
They do,
so that they can't get the contaminated groundwater.
Right.
basically, so.
yeah.
Yippee-ki-yay.
I think we're good.
Good.
Thanks, gentlemen.
All of them with cross.
I would like to put a shout out to the major.
Which one?
That one.
So he showed up at the Kent Narrows development,
KNDF?
and he just hit it out of the park.
Good job.
About the,
What did,
Unsanctioned carbon?
yeah.
Unsanctioned
we're on
carbon.
TV, so I
Oh, that.
can't ask him a question.
Yeah.
but I can't.
Yeah. So he calmed people's nerves, and he said, look, this time we're proactive, and he actually reached out to the organizer of this event and said, look, man, just be responsible, be reasonable, don't
Usually
don't
found
get out of line.
a lot of these,
or else
a
I'll arrest you.
lot of these events, if you reach out to whoever's hosting them and you kind of set the ground rules, you won't have as many issues.
And their site, I mean, granted, their website that promoted it said, don't do this, don't do this, don't do this, don't do this, and we're never gonna be able to come back.
Yeah.
But don't ruin it
He
for us.
did, and he's a ex-prison guard. So he's got, some kind of respectful background of, we're not just gonna come out here and act foolish. And he lives down, he sees the H2O stuff, sees how it's spun out of control for all those years, and, he said, but he can't control everybody that shows up.
Right.
You can advertise it, and everybody has all the right intentions, but it also brings in a lot of revenue to these restaurants. And if one of the first things out of his mouth was, we want to come down there and we go to the dock house and eat. How you gonna make an argument on this one?
Right.
Like, it's bringing people down to, they have an event earlier that morning for donuts and coffee and whatever else like that, local businesses. So as long as they don't act foolish, have a.
Agree.
I think this will be a good test.
It's also a public space.
Right.
So you're kind of limited on certain things that you can do, but we'll have extra people down there anyway. We have state highway grant that's that'll be paying for some folks for traffic enforcement during that time. We also have quite a few other events that day.
MDTA.
We got opening day, 2 different parks. We'll have people out there to make sure that crime doesn't happen.
Well, we appreciate that very much.
All right.
Thank you all very much for your time.
Go Terps tonight?
Yeah.
Anybody Terps fan?
O's, what was it? O's won?
Terps fan?
O's
Nobody?
O's won 12-2. Wow. And they hit 6 dingers.
Yeah, they right too.
Was Gunnar Henderson, is he back?
No, he's not even playing, no. And, what's his name, only got one single, the young boy. Holiday.
My son's ex-Maryland now.
He went 1 for 4?
Yeah.
1 for 5?
Your ass.
Where's he
Fourth
bat?
year of 5-year reputation.
He went 0 for 4?
It's great.
Well, if you
He's
think
so
about
big, he
it,
probably won't
I mean, the
know.
reason why they bat first, second, third, and fourth
I'll be watching the game.
spots is
That
because
was
they
a
want
night,
them to get at least
three-pointer
3
with
or 4.
nothing left at Colorado
Yeah,
State.
so we need a motion to adjourn?
Yeah, they put the other
Yeah, that's all we had, Commissioners, for tonight. Our next work session is on April 1st, same time, 5 o'clock. Public Works, Bay Bridge Airport, Blue Heron Golf Course, Public Landings, Parks, and Recreation. Anything else for the sheriff, or anything else for the good of the cause?
All right, I'll entertain a motion to adjourn.
See you guys, thanks.
All right.
Thanks, guys.